Thank you and welcome on behalf of Peace and Education and Stopping Prize. Definitely want to acknowledge Ashanti and Charles Drew. They've been key players as we've been moving forward and trying to help support the formation of this coalition. We received a small mini grant to look at the impact racism has on systems. And we hear so much about criminal justice systems, health care, we don't hear enough about. So when I looked at Compton's health profile, I was shocked to see the results and the impact, to realize that Compton had the poorest health outcomes of any city in LA County. So what we initially began doing was interviewing city leaders, community members, community organizations to find out what they knew about healthcare resources and where were service gaps, what were the needs. So we began by verbally having these interviews, took anywhere from 30 minutes to an hour, and we documented that, we captured that information. Based upon that information, we moved to our second step, which was to hold a series of community dialogues. We put those dialogues in two separate categories. We wanted first to hear from the community leaders, to hear what they understood the community's needs were, to see what steps the community leaders, the elected officials had taken to ensure ways to improve not only access to healthcare, but to improve overall health outcomes. Then we had a second set of dialogues with community members. And our final attempt was to bring both sides together so that they could be in the same place and hear each other and have this very fruitful, dynamic conversation. Well, that did not happen. But what did happen was that we had some really dynamic community leaders who emerged from that conversation and said, yes, we definitely need to look at health care, how to improve access, how to improve overall health outcomes. And those key community leaders really were the core foundation of, okay, this is our next step. So we thought the next step is for community members, for Compton community members, to know who Peace and Education was. So we began outreach, and Kayla Owens, who's one of our facilitators here, is our director over outreach. And so she connected us with, different organizations so that we could go out in the community, get to know community members, get to know organizations, so that they would know who we were. One of the things that we were tasked with, and we were told very clearly, that nothing would change in Compton unless we, and I mean we, Peace and Education, were willing to stand here, stand in this community to make sure things moved along. There was very little trust. There was very little hope. And I have to say that there were times when it was very disheartening. But there also have been some times where there's been some wonderful lights of glimmer and hope, and that's where we are today. So after we've had the dialogues, we started looking at, okay, how can we connect with organizations? What's the best approach? We thought we needed to establish some credibility, because even though we were out in the community, people didn't know who Peace and Education was. They didn't know what community mediation centers do. Most people don't. So we reached out to Candace Leos with Compton Advocates, and she's been great and very supportive, and said, okay, how can we work together to help build this coalition? We then had the privilege of having several coalition meetings where Derek Brown, who is with us tonight, he's our interim president. We had Ashanti there. We've had a couple of other community members join us. The last 3 years have been very, very challenging. But again, I speak from a place of, I think there's hope because all of you are here. There is a desire, and you don't need 20,000 people to create change. All you need is a handful. And I'm hoping that all of you will be that handful, because you do recognize the need, or else you wouldn't be here. So our goal, Peace and Education, our goal is to help support the coalition, as Mary Grace said, help support the formation of the coalition. The coalition will be as strong as each of you bring your collective voices, your collective wisdom. And we want to help make sure that you have the infrastructure you need, you have the technical support that you need. And in a year, we're hoping that this coalition will become its own 501c3, and you all, as members of the community, individuals, organizations, will then be the voice to advocate for better health outcomes for the residents in the city of Compton. I want to talk very quickly about some of the goals and objectives for the coalition. One really, really important one, I think, is the sharing of resources. You all can get so much accomplished in the, as your own independent organization, but just think what you can accomplish when you're collective. The collective wisdom, the collective experience. That's what the coalition brings together. You become a union of organizations working toward a shared vision. And that vision is improving health outcomes for the city of Compton. You foster this collaboration that we oftentimes don't see. People tend to work in silos. This is my organization. This is what I do. This is my organization. This is what I do. And that's fine. But history has shown us things shift when numbers increase. So when you can bring your collective voices together, you can move mountains. The other goal of the coalition ultimately is to bring together grassroots organizations, to bring community members together and look at ways, activities, strategies, and how you can work together to improve not just access. And I don't want anyone here to leave saying, okay, this is just about access. We have healthcare clinics. We have other resources. That's great. But what you don't have, what Compton does not have for over 100,000 people, is a comprehensive, fully comprehensive medical facility. And that's what every community deserves. We have heard from community members how much of a challenge it is to get, just transportation to get maybe to Gardena Memorial, or to get to St. Francis, or to get back over to Harbor UCLA. A lot of the community members don't even realize that Compton is no longer a public health facility. I mean, not Compton, Martin Luther King is no longer available to the community. It's private. So when you think about what happens to your community members after 5 o'clock, after your clinics close, you think about folks that have chronic health illnesses. We've heard stories of people dying waiting on an ambulance to get a call to determine where they're transported. That should never happen. That's inhumane. That is, in my opinion, based upon what I have read, the direct impact of racism. You won't see that in other communities. It is unfair. So we hope the goal for this coalition is that your voices will rise up and hold your elected officials accountable to the community to improve the community's overall health. Everyone deserves health care, not just access to health care, but quality health care. Health care 24 hours of a day, not just from 9 to 5. Mm-hmm. And so our goal is to work with this collective in supporting you in creating an infrastructure where your collective voices will speak loudly, clearly, with clarity and expectations of what your community needs. Now, what Peace and Education can give to this cause is that, as Mary Grace said, we can be conveners of your meetings. We can be conflict resolvers. We can do outreach and promotion. We can design community conversations, which we've done. We can also be a resource to the community in the fact that we can mediate conflict between organizations, between families. Anything that's civil, we can mediate except for child custody. So if it's a landlord-tenant situation, if it's a dynamic between families, if it's a dynamic between businesses, we can be a resource specifically around conflict resolution, but we can also be a resource around social justice because healthcare is a social justice issue. And so what we want is to improve for this community, give every community member, every child. I should never have to hear a story. We should never have to hear a story of a child dying from asthma. That makes no sense. We've got to do better, but we can't do it. The power comes from within the community, and that is all of you. So that is our goal. We're here to support you in whatever way that you need us to, but we want to see this coalition rise up and speak up and advocate for community members whose voices have been silenced for far too long. Thank you.